Standard versus transmission-based precautions. Hello everyone. Welcome back to the channel. Hope you're doing well. In this video, we are going to talk about standard versus transmission-based precautions. So if you watch my previous videos on infection control, then you already know that we have standard precautions and transmission-based precautions. In this video, we're going to discuss what is standard precautions, when do we use it, and then we'll talk about transmission-based precautions. What is it, and when do we use it? So let's start with standard precautions. Standard precautions are a basic level of personal protective equipment and infection control practices that we use for every patient, whether they are at home or in a hospital setting. This does not change from patient to patient. Standard precautions are designed to protect you and other people from exposure to blood and other potentially infectious materials. Examples of standard precautions include wearing gloves when you're re-performing a procedure that involves contact with blood or other potentially infectious materials, wearing eye protection when splashes or sprays of blood or other potentially infectious materials may occur, wearing a mask when there is a risk of exposure to airborne infectious particles, using a gown or apron when there is a risk of contamination with blood or other potentially infectious materials. And also, always wash your hands thoroughly with soap and water after removing your gloves. You should also never eat, drink, or smoke in areas where there is a risk of exposure to blood or other potentially infectious materials. Now let's move on to transmission-based precautions. These are additional precautions that we take in addition to standard precautions when a patient has an infection that can be transmitted through the air, contact with surfaces or objects, or through blood and other body fluids. Examples of infections that can be transmitted through these routes include tuberculosis, COVID-19, hepatitis B and C, HIV, norovirus, and Clostridium difficile. When you are taking care of a patient who has an infection that can be transmitted through these routes, you will need to take additional precautions to prevent the spread of infection. Examples include placing the patient in a private room with the door closed, wearing a surgical mask or an N95 respirator if the patient is coughing or sneezing, wearing gloves when handling the patient's soiled linen or equipment, and disinfecting the patient's environment more frequently. So in summary, standard precautions are the basic level of infection control that we use for all patients, while transmission-based precautions are additional precautions that we take for patients who have an infection that can be transmitted through the air contact with surfaces or objects or through blood and other body fluids. I hope this video was helpful. If you have any questions, please leave them in the comments below. And don't forget to like and subscribe so you don't miss out on future videos. Thanks for watching.